Hello, I'm Dr. Rhonda Johnson. Today is Sunday, March 9th, 2025, and today I'm doing a COVID-19 update, what you need to know about these latest variants. Well, as you know, COVID-19 is still here, there, and everywhere. You may not hear much about it anymore. So let's talk about what's dominating the variant landscape now. According to the CDC's COVID data tracker website, 2 Omicron subvariants are currently leading in the United States. LP 8.1 accounts for up to 42% of sequence variants. This variant is highly transmissible because it has superior immune evasion and efficient cell receptor binding. It is expected to become the dominant strain globally. And the XEC variant, it was previously the dominant strain. Now it makes up about 31% of cases in the U.S. Now, both LP 8.1 and XEC are descendants of that JN.1 highly prevalent variant last year. Now, LP 8.1 has already been detected across multiple regions, including the Americas, Africa, Europe, the Western Pacific, the Eastern Mediterranean, and Southeast Asia. So what are the symptoms to watch out for? While these new variants cause symptoms similar to previous ones, those Omicron flirt strains, including fever, chills, cough, sore throat, runny nose, congestion, muscle aches, fatigue, your symptoms may be a little different. But symptoms can appear for 5 or more days after exposure, and people can be contagious 1 to 2 days before they have symptoms and for several days after they subside. And of course, some people may have mild or no symptoms. And some people may have detectable virus for up to a week after their symptoms clear. And some folks may experience rebound symptoms. So what about those COVID tests and treatment? Good news is that at-home COVID tests still work effectively against these new variants. If you have a negative first test, but you continue to have symptoms, please retest in about 2 days. And remember, you are contagious as long as your at-home test remains positive. Now, what about the antivirals such as Paxlovid? They still work for high-risk individuals. Now, what about the vaccine effectiveness in the booster guidance? Well, the 2024-25 COVID vaccine does still work, but it has limited effectiveness. It's only 45% in preventing hospitalization in immunocompromised adults 65 and up, and only 30% effective at preventing ER-related visits in adults 18 and up, according to the CDC. So that's part the reason why they recommended a second updated vaccine for high-risk and immunocompromised people. So what's the bottom line? COVID is here. It continues to evolve. These new variants each one is more transmissible than the next one, and it's here to stay. These vaccines have been evading your existing immunity, so that's why you are at risk for reinfection. Always talk to your doctor or your healthcare provider about your COVID-19 vaccine strategy. And remember, prevention through wearing a high-quality fitted mask indoors in crowded places, improving your air circulation, and using air filtration can help prevent the risk of infection. That's my message today. Take care and be well.